the relative short-term immunity we're talking about was relative to antibodies, which are the essentially response proteins that your body produces against the introduction of a virus. And what we were saying, what we seem to find is that those antibodies come up after you become infected and they drop back down over time. And they seem to drop down after 3 to 4 months. Now, what we don't measure routinely or commercially in labs, and instead is more of a research project, are the cells that actually produce those antibodies and what we call your NK cells or your T cells and B cells. And those cells in general maintain a memory of the viruses or the different type of pathogens that you've seen in the past. And the early research at this point seems to indicate that your body does indeed retain a memory of having seen COVID before. And if it behaves like much every other virus, and while there are some things about this virus that seem to be different, it very much acts like many other viruses that we've seen and studied for decades in general. I do think that your body probably does have an immune response that will respond potentially a second time when you see COVID. We're not seeing huge numbers of repeat COVID infections in patients that have suffered it before, at least not documented at this point. I mean, those numbers are less than 100 across the world that I'm aware of, out of near 35 or 37 million documented cases to this point. So reinfection does not seem very likely, but I believe the opportunity to receive the vaccine potentially, and again, just give your immune system any boost you can against that virus, can be beneficial for us.